Dental Office Emergency Case Scenario Project Diabetic Episode by Megan Sodders. Actors are Laura and Dustin. The patient arrives for their 1 p.m. appointment and states they were running late. The patient did not have time to eat lunch, but the hygienist proceeds to clean their teeth. The patient then goes into a diabetic episode.
How are you today?
Oh, I'm doing better now that I finally made it here. I'm sorry I'm running late.
It's fine. I see that you're diabetic.
I have diabetic, yes.
How you feel?
Yeah, right now I feel okay. I'm just trying to calm down. The traffic was bad. So.
Okay, so we'll start with the children.
Okay. Actually, I'm kind of starting to feel like a little lightheaded.
Did you eat this morning?
No, I didn't have a chance to eat. I was just trying to get here.
We're having a medical emergency. I need emergency kit. Here's the emergency kit. Thank you. This is a glucose tablet. I will help you with your glucose levels. You feel better?
Yeah, I'm starting to feel a lot better. I can feel my energy coming back. Thank you.
A diabetic episode occurs when the body experiences low blood sugar levels or hypoglycemia. A diabetic episode usually occurs with diabetics, but even though you do not have diabetes, you could possibly experience a diabetic episode. Signs and symptoms of a diabetic episode include dizziness or fainting, weakness, clammy skin, shakiness, nausea, vomiting, intense hunger, cold, and profuse perspiration. Treatment options include providing the patient 15 to 20 grams of some form of sugar, which could be table sugar, soda, honey, candy, orange juice, or glucose tablets. You want to give the patient 2 to 6 glucose tablets, or you can give them the glucose paste if that is available. The glucose tablets are found in our medical emergency kit in our clinic. The airway should be secured and vital signs should be monitored. Once the glucose has been administered, you should see a positive response within 10 to 15 minutes. If the patient is unconscious and is not able to take a glucose tablet, the treatment of choice is glucagon. In order to prevent diabetic episodes, the hygienist needs to make sure they go over the medical history thoroughly and note that the patient is a diabetic. They need to then ask the patient if they ate today and make sure they have eaten before their appointment. They need to schedule appointments in the early to mid-morning hours and keep appointments short. Then it is best to check the patient's glucose levels before performing a procedure. You also want to look for signs that the patient is not feeling well, so you can avoid diabetic episode.